In Ottawa today, Prime Minister Minister Trudeau, at a press conference at the National Press Gallery, has announced that the Government of Canada will invest $1 billion as their response to the coronavirus. Here is the news conference. This is James of Net News Ledger reporting from Thunder Bay.
Hello, everyone.
Thank you all for joining us. Over the past few weeks, we've seen COVID-19 spread around the globe. Here in Canada, 93 cases have been reported, and on Monday, one person died. Before we go any further, I want to extend my sincere condolences to their family and friends. Our thoughts are with them as they navigate through this difficult time. Depuis le début, nous adoptons.
From the beginning, we have taken a whole-of-government approach to contain the spread of COVID-19 and ensure that Canadians are kept safe. We have been working very closely with municipal, provincial, and territorial counterparts to reduce risks to Canadians. The Intervention Crisis Group is meeting regularly to provide updates on the situation. Minister Haidu and Dr. Tam are keeping Canadians up to date on the most recent developments and are issuing daily recommendations. Ministers Baines, Joly, Morneau, and Ng are closely tracking the current and potential impacts of the virus on the various sectors of our economy. And Minister Champagne is working with international partners as well as the World Health Organization to contain the virus on a global scale.
Uptick in the total number of cases around the globe, we took additional steps. Last week, we announced a special committee chaired by Deputy Prime Minister Freeland to manage the federal response to the outbreak. We've also put in place screening measures at airports. We've increased testing at the National Microbiology Laboratory. We've invested in research. We've bolstered support for health services in Indigenous communities. But the reality is that the number of people affected by the virus around the globe keeps climbing. Canada has been fortunate so far. We have not seen a drastic spike in the number of cases reported, but I know that people across the country are worried. Worried about their health, worried about their aging parents, worried about the kind of impact this virus could have on their job, on their business. Since day one, our government has been following the situation very closely. We have a responsibility to make sure Canada is ready for all scenarios, and we take that responsibility extremely seriously. That's why today we're announcing a comprehensive package to address the impacts of COVID-19 on our country and to keep Canadians safe. Our government will be creating a $1 billion COVID-19 response fund, which will provide money to the provinces and territories to deal with preparation and mitigation for the virus. I want all premiers and all Canadians to know our government is here for you. We will make sure you have everything you need. Notre gouvernement créera un fonds de lutte contre la COVID-19 d'1 milliard de dollars qui fournira du financement aux provinces et aux territoires pour se préparer à toute éventualité et à atténuer les risques à la population. À tous les premiers ministres provinciaux et à tous les Canadiens, notre gouvernement est là pour vous. Nous allons faire en sorte que vous ayez tout ce dont vous avez besoin. The fund will provide $200 million to support the ongoing federal response to the virus, including more money for things like surgical masks and face shields, increased capacity for services to Indigenous people and other federal healthcare responsibilities, and for continued public education efforts to Canadians. It will also invest $275 million in additional funding for research and medical countermeasures, including vaccine development and support for clinical trials. On the economic front, our government understands the disruptive impact the virus is having on businesses and workers. That's why we will waive the mandatory one-week waiting period for employment insurance to kick in. We're also introducing, among other things, special measures under the work sharing program to help employers who fall on hard times due to COVID-19. Let me be clear. No one should have to worry about their job if they have to be quarantined. No employer should feel like they have to lay off a worker because of the virus. We can support you, and we will. Today's announcement is significant, but we are already preparing to do more if need be. Should businesses face a cash crunch in the short term, they can easily access credit to bridge to better times. We will work with our financing crown corporations through the Business Credit Availability Program to protect jobs and to be there for businesses. As we saw over the past few days, the outbreak is having an impact on the global economy. It's affecting supply chains, commodity prices, our oil and gas sector, tourism, and more. I know this is adding to people's anxieties. With a strong balance sheet and a resilient economy, Canada is well positioned to deal with these challenges. Canadians can count on us to provide them with the right kind of support as the situation progresses. En ce moment, les pays dont les systèmes de santé sont plus fragiles sont plus à risque de voir le virus se propager. C'est donc pourquoi notre gouvernement allouera également 50 millions de dollars pour aider les pays qui sont particulièrement vulnérables. Pour contrer la COVID-19, le Canada pose un regard global sur la situation actuelle. D'abord, on réalise des investissements additionnels pour faire en sorte que nos systèmes de santé et nos professionnels de la santé soient prêts à toute éventualité. Ensuite, on travaille avec nos partenaires internationaux de façon à ce qu'ils possèdent les ressources nécessaires pour empêcher le virus de se propager chez eux et à travers le monde. I know that people are worried about what they're seeing on the nightly news and what it means for their community. We get it, and we're on it. We're working with our international partners to contain the virus. We're applying the lessons we learned during the SARS outbreak. We're making sure our healthcare systems are resilient. We are pulling out all the stops to make sure Canadians stay safe, healthy, and supported. Canada is among the best prepared countries in the world to respond to the situation we're facing. We will get through what comes next together. Encore une fois, merci d'être des nôtres ce matin. Je suis maintenant prêt à prendre vos questions.
Merci. Alors, comme toujours, une question, ensuite une question de suivi. Il y a des micros qui circulent. On commence par... on a 25 minutes, soit dit en passant, beaucoup de noms sur la liste, donc soyons efficaces. Kevin Gallagher, CTV News. Ensuite, Émilie Bergeron, QMI.
Good morning. Thanks for taking our questions. So first, last week, of course, we had the $27 million for research, and now it seems that that number has grown by a large margin to $275 million. So perhaps explain why this new investment is needed and what it will be going towards.
We recognize that this challenge is evolving, and it's a global challenge, and Canadian science and Canadian research are among the best in the world. That's why we're ensuring that the investments we're making in our science and research are going to respond to this challenge. But for more details, I'm happy to turn it over to Dr. Tam or Patty for Minister Haidu. On where the research is going.
Thank you. We do call each other by our first names occasionally. So listen, as you know, we announced last week almost $30 million for research. But I will say that we had a volume of calls, or volume of responses from researchers across the country that were also excellent proposals. Amplifying our ability to fund those proposals at this time allows us to much more quickly generate the research that we need to understand, as the Prime Minister has indicated, how we can better contain the illness, how we can actually develop a vaccine that will be effective, and what kinds of treatments are effective with this particular disease. It's obviously a Canadian response in terms of research, but it contributes to the global community of researchers that are working so quickly to try and figure out how we manage this particular virus. Thank you.
And as far as the, now I guess, no waiting time for EI. So how will that program roll out? I mean, will there have to be a diagnosis of COVID-19 or suspected case I guess I'm really asking, how can you avoid people abusing this type of change to a very important government program?
We have confidence in Canadians. We know that what is extremely important right now is every Canadian does their part to arrest the spread of this virus, to slow the infection curve that we're seeing elsewhere around the world. We know that by keeping a slower pace for the spread of the virus, we will avoid overburdening our healthcare systems and prevent more people from getting the illness. So we need to make sure that everyone is given the tools they need, whether it's figuring out how to stay home from work and work from home, working out with your boss on avoiding rush hour congestion times in public transit, whether it's making smart decisions around shaking fewer hands, washing your hands more often with soap and water, coughing to your elbow. These are things that will actually help Canada and the world fight the virus.
La question va plutôt à Guillaume Saint-Pierre du Journal de Québec, ensuite David Cochrane de CBC News.
Bonjour, je voulais savoir, dans quelle mesure est-ce que ça change vos plans dans l'élaboration de votre budget? Est-ce qu'on attend toujours un budget au mois de mars? Et dans quelle mesure vous êtes prêt à enfoncer, à faire plus de déficit? Bon, là, vous annoncez 1 milliard. Là, donc,
Certainement, ça a un impact sur nos réflexions par rapport au budget, mais je peux souligner que les décisions qu'on a prises en tant que gouvernement au cours des 5 dernières années nous laissent une bonne marge de manœuvre pour des situations d'urgence comme celle-ci. On va pouvoir être là pour investir, pour aider les entreprises, pour aider l'économie canadienne, pour aider les travailleurs, les Canadiens qui font face à des situations difficiles à cause de ce virus. Donc, évidemment, nous suivons attentivement tout ce qui est en train de se passer au niveau économique, mais au niveau de l'économie globale aussi. Et on va réagir en conséquence avec notre budget.
et vous, personnellement, et votre famille, est-ce que vous avez changé vos habitudes pour contrer la propagation du virus?
Absolument. Je pense que tout le monde peut et doit changer ses habitudes face à ce virus, de se laver les mains beaucoup plus souvent avec du savon, de tousser dans le creux de notre coude, d'éviter de faire des poignées de main dans la mesure du possible. Nous pouvons tous faire des choix dans nos vies de tous les jours par rapport à comment on travaille, où on va, qui vont pouvoir aider à freiner la propagation de ce virus. Et je pense que c'est important que les gens sachent qu'ils peuvent effectivement garder leur famille et toute la communauté en santé en suivant les recommandations de Santé Canada.
David, ensuite Joël Denis, Bellavance de la presse.
Hi, Prime Minister. We've seen some projections from people doing modeling on the possible or probable rate of infection in the country, anywhere from 35 to 70%, depending on the range of public health mitigation measures. I'm sure the federal government has been running its own modeling. At this point, what is your sense of the most probable rate of infection in Canada? What should Canadians be prepared to deal with here?
I will turn it over to Dr. Tan and the Health Minister for more specific answers on that. But I can tell you that there are a range of scenarios that we are facing, and the largest factor is actually Canadians' own behavior. We can, by making smart choices as citizens, to follow the instructions of Health Canada, to wash your hands more often, to cough into the crook of your elbow, to stay home and self-isolate if you're beginning to get symptoms of a coronavirus. We can slow down the spread of infection in Canada, and that will prevent from overburdening our healthcare system and allow this disease to be managed more effectively in a way that will have a lesser impact on Canadians' health and on the health of our economy as well. But I will turn to the experts. Dr. Tam, for a perspective on this.
Yes, thank you for the question. It is important to prepare for a range of different scenarios. But of course, it's sensible to prepare for something worse than prepare for something that's mild. Right now, in Canada, throughout the public health system, people are trying to identify every case and their contacts in order to slow the spread of this virus into the country. That's a lot of work. But the work actually does matter. As the Prime Minister has said, you need to sort of prevent this rapid rise in cases that will really impact our health system. And by these social distancing measures and people doing the right things, particularly staying home if you're sick, don't spread it to other people, really does make a difference. Protect those who may get the most severe illnesses, and then the message that we want to send out there, because that epidemic curve and the number of people who get seriously ill and go into your health system depends on all of us to protect those who may get more severe illness. So around the country, you're going to see different jurisdictions trying to protect their long-term care facilities or nursing homes in terms of setting up procedures. But it also means in individual families, you may have elderly parents or grandparents, and you may have people with underlying medical conditions. But I also want to say that the majority of cases, if we looked around the world, are actually in working age adults. And so business continuity and work planning using these scenarios are very important. But also to say that, of course, that's why the supports for people to do what local public health asks them to do is just so important. So at least from my perspective, the advantage of being in the Canadian system is that people will be supported to do what public health has asked them to do. But everyone actually can change the dynamic of that curve. So that's such an important message that I don't want people to lose sight of. Individual physicians can't do it. Public health units on their own can't do it. Everyone has to contribute.
Based on that, do you have a probable percentage on the rate of infection that you're anticipating? And based on your forecasts, should Canadians anticipate large-scale restrictions on freedom of movement and travel within our borders the way we've seen in other countries?
There are, of course, a range of scenarios that we are accounting for so that we're ready regardless of the eventualities. But at this point, our strongest recommendation is for Canadians to be involved in keeping themselves and their families safe, and that will slow the rate of propagation through our country. That is the strong recommendation we're making now. We've also put forward measures to support workers, to support businesses. We're supporting provinces with increased health transfers to be able to allow them to prepare, even in provinces and territories where there are no cases yet, to prepare their health systems to receive cases. We know there is much that we can do now, and we're doing it. We also need to prepare for eventualities, and that's also what we are doing.
Denis, ensuite, ce sera Tanda McCharles.
Bonjour, M. Trudeau. Est-ce que le gouvernement songe à fermer les frontières à des pays qui ont beaucoup de cas comme la Chine, par exemple, ou encore l'Italie, pour éviter que le virus se propage davantage?
Nos décisions sont toujours basées sur les recommandations des experts. On n'a pas choisi de fermer les frontières à la Chine dans les débuts, et je pense qu'on a pu voir qu'on a pu restreindre la propagation du virus au Canada depuis plusieurs semaines parce qu'on avait les informations appropriées et des mesures en place aux aéroports pour que les gens puissent prendre soin d'eux-mêmes et éviter la propagation. On va continuer de prendre les décisions nécessaires selon la situation. On ne ferme pas la porte à aucune éventualité, mais toutes nos décisions seront basées sur les avis des experts et les recommandations scientifiques qui sont les meilleures qu'on reçoit.
Vous avez parlé, vous avez changé votre comportement, et vous et votre famille. Est-ce que, dans la sphère politique, est-ce que vous comptez limiter les rassemblements politiques, par exemple, pour votre parti politique? Et est-ce que des sommets internationaux comme le G7 et le G20 pourraient être tenus peut-être par vidéoconférence plutôt que d'assister en personne?
Et c'est certainement des réflexions qui sont en train de se passer. Je sais que la Chambre des communes est en train de réfléchir à nos comportements et de voir s'il y a des étapes qu'on devrait prendre si l'évolution du virus continue de s'aggraver. Nous allons continuer de faire des choix basés sur les recommandations de Santé Canada. Et c'est ça qui est important, de souligner que les organismes, les entreprises, les conférences, des individus, des familles suivent les meilleures recommandations des professionnels de la santé pour se garder en sécurité, pour garder la communauté et le pays en sécurité. Nous avons tous des choix que nous pouvons faire pour ralentir la propagation de ce virus et nous devons toujours être ouverts à prendre ces décisions-là en temps et lieu.
Good morning.
Sorry.
Tonda.
Excuse me? Oh, then it's Louis.
Yeah, it's a mic situation. Makes sense.
Thank you. Good morning. Could you tell us, Prime Minister, what you see as the potential impact in Canada of the spread of the disease in the United States? Since we share a landmass, we have open borders. What is your estimation? What's your perspective on the threat posed to Canada by the U.S. situation?
Yeah. Obviously, our economies between Canada and the U.S. are deeply intertwined. The number of travelers across our border every day are many, many, many thousands. And therefore, that is a real potential vector of transmission, but we need to know that there are many, many things being done both in Canada and the United States to slow the spread of this virus. We continue to engage extremely regularly with our counterparts in the United States to ensure that we are handling as best we can the spread of this virus. We will continue to monitor, to coordinate, to ensure that what we are doing has as minimal impact both on Canadians' health, but also on the growth of our economy.
Can you be more specific about what you have assessed as the impact currently to date over the last 2 months on the Canadian economy from the virus outbreak, including on the tourism and travel sectors?
Okay. Obviously, there are slowdowns in the tourism sector. The recommendation not to take cruises has had an impact. There are many things. I spoke with the heads of some of our airlines yesterday to hear directly from them on some of the challenges. We've been reaching out to businesses and leaders across the country to get a better a better idea of the impacts and the potential impacts on our economy. The finance minister has, of course, been deeply engaged in that in the preparation for the budget. So I'll turn it over to you, Bill, now to fill in on that question.
Well, I think it's an important question that we've been very focused on. I guess I'd let you know that we're in daily contact with all of our banks. Our banking system is strong. They're not seeing as yet any challenges around credit, but as the Prime Minister mentioned, we are preparing business credit availability, and that's an important measure that we used previously. It's expandable, so we're prepared for the eventuality. We're looking to make sure, first and foremost, that we think about health, which will have an impact on businesses as well. If we can mitigate the challenge over a period of time, that will be an important mitigation factor for businesses and for our broader economy. But we stand prepared with multiple measures in order to support businesses and to support people should the challenge be greater than it is today, which of course we expect in certain sectors.
Merci. Louis et ensuite Paul Vieira du Wall Street Journal.
Monsieur Trudeau, est-ce que vous allez suspendre l'arrivée de bateaux de croisière au Canada, considérant le risque élevé de contamination? C'est quoi les facteurs qui vont influencer votre décision?
Les facteurs qui influencent nos décisions sont la santé et la sécurité des Canadiens, toujours. Nous sommes en train de regarder différentes mesures, y compris les bateaux de croisière. La saison va commencer bientôt et nous devons avoir une réflexion sur comment on va protéger les Canadiens qui pourraient prendre ces bateaux de croisière, qui pourraient travailler sur ces bateaux de croisière, mais aussi les communautés qui pourraient être affectées par ces bateaux de croisière en visite. C'est une réflexion qui est extrêmement actuelle pour nous et on devra en avoir plus à dire dans les jours à venir.
Monsieur Trudeau, est-ce que vous avez subi vous-même un test de dépistage du COVID-19? Je pense que vous avez été dans un événement la semaine dernière où il y a des gens qui étaient infectés. Est-ce que vous avez subi le test? Y a-t-il un résultat?
Je n'ai pas eu de test. Je suis en train de suivre les recommandations de la Dr Tam par rapport à comment me garder en sécurité et à ma famille aussi. Mais je tournerai le micro à la Dr Tam pour partager ses recommandations pour quiconque aurait été à cette conférence, une conférence semblable où il y a une personne qui aurait été infectée. Dr. Tam, on the PDAC conference.
Thank you. On travaille vraiment étroitement avec les homologues provinciaux et les homologues du municipal aussi, parce que cette conférence est une conférence internationale. Le Conseil de santé publique et de surveillance de soi-même, notre santé, de tous les participants de cette conférence. Ainsi, un participant a un petit symptôme, c'est vraiment important de rester chez eux immédiatement et de contacter le médecin ou la santé publique pour les prochaines étapes, peut-être pour le dépistage aussi. Donc, c'est vraiment important pour les participants de vraiment prendre soin de leur santé et de bien surveiller leurs symptômes. Ça, c'est le plus important.
Paul et ensuite Marie Vassette du Devoir.
Good morning. Japan this week came out with a $15 billion financing package to help companies deal with the coronavirus threat. Britain today introduced a budget with what's a £30 billion package, fiscal package to protect against coronavirus. Why are we not being so aggressive at the start, given some of the risks that are evident? And are we not at risk at underestimating the damage to the economy, not just from the coronavirus fallout, but also the sharp plunge in crude oil prices this week?
The message we have for Canadians and for Canadian businesses is that we will be there for them. What we've put forward today are significant measures that will both support workers and businesses as they face challenges due to coronavirus's impact on the economy, but also measures that will keep Canadians safe. But as the Finance Minister has said, and as we will keep saying, we are ready to do more as the situation warrants it. We know that Canada is in a good position so far, both fiscally and with a strong health system that has managed to slow the spread of virus in Canada, but we are always ready to do more. We will be there to support provinces. We'll be there to support businesses. We will be there to support Canadians through this difficult time.
Bonjour. Je veux poursuivre un peu sur la question de Louis. Est-ce que, je comprends que la Chambre des communes envisage quoi faire de ce côté-là, mais vous, en tant que chef du Parti libéral, est-ce que vous envisagez d'interdire ou de suggérer fortement à vos députés d'arrêter de voyager, compte tenu que 2 de vos députés, dont un de vos ministres, sont maintenant en isolement volontaire à la maison, que vous, malgré vous, je présume, vous avez été en contact avec quelqu'un d'infecté. Est-ce que vous envisagez de peut-être dire aux gens d'arrêter de se déplacer puis rester à Ottawa pour l'instant?
On est en train de suivre les recommandations des experts en santé publique et ça s'applique aux individus, aux députés, mais aussi à notre Parlement. Moi-même, je suis en train de modifier mon horaire pour ajuster nos déplacements, pour aller là où on peut aider, mais pas interférer avec le travail qui est en train de faire sur le terrain, dans la recherche et d'autres. Nous savons que nous devons tous, en tant qu'individus, en tant qu'organisme, en tant qu'institution, suivre les recommandations des experts en santé pour assurer la santé des Canadiens, de nos familles et minimiser l'impact économique.
Bien, pouvez-vous élaborer sur vous-même, vous êtes en train de voir votre horaire, est-ce que vous avez changé des déplacements ou annulé des déplacements? Puis ma follow-up, peut-être c'est pour vous ou pour M. Morneau, l'argent qui va aux provinces pour le problème de santé, est-ce que c'est proportionnel selon la taille de la province? Est-ce que c'est proportionnel selon leurs besoins? Et est-ce que vous le versez tout de suite ou est-ce que vous attendez de savoir quels sont les besoins?
D'abord, pour mon horaire, on va vous garder au courant au fur et à mesure qu'on a des annonces à faire. Mais oui, on a fait des changements dans mon horaire pour la semaine qui vient. Par rapport à l'aide aux provinces, on annonce 500 millions de dollars dans le transfert pour la santé aux provinces. Et ça sera distribué dans les proportions habituelles.
Il nous reste 5 minutes environ. On va passer à David Aiken de Global News. Ensuite, ce sera Raymond Filion de TVA.
Thank you, Melanie. Good morning, Prime Minister. The premiers arrive at the end of the week, and I know that on the agenda is discussion about fiscal stabilization. We heard Premier Kenney earlier in the week ask for lifting retroactively of the cap on fiscal stabilization. So as you sit down with him, what's the argument against that, or what are the factors from your perspective on lifting that cap?
I'm looking forward to sitting down with the premiers tomorrow to talk about a wide range of issues that affect Canadians right across the country. The coronavirus will, of course, be a prime element of discussion, both in how we're ensuring we're going to keep Canadians safe, how the federal government will be there to support the provinces and their health systems as they tackle this challenge. But we will also talk about the impact on the economy, on workers right across the country. The oil and gas sector is being particularly hard hit right now with the drop in global oil prices. So we will be discussing with Premiers Kenney, Moe, and Ball the impact on our oil-producing provinces and how we can ensure that we are supporting families who are facing difficult times.
And just following up an issue you've touched on, recognizing Dr. Tam has said it's up to us as Canadians to keep ourselves safe, our families safe. As we talk about this flatten the curve hashtag, have you talked about when is the time that there may have to be some mandatory restrictions on the freedoms Canadians take? Is that your job, or is that the provincial health authorities will impose those mandatory restrictions?
Well, it's not about time. It's about the situation and the facts on the ground. We will closely monitor what is needed to be done to keep Canadians safe. We, of course, will focus on voluntary measures, on encouraging Canadians to follow the advice of their health professionals, to look at their own lives and how they can make small changes that will keep them and their families safe alongside keeping their communities safe. We recognize that Canadians have been through health challenges before. We remember well the SARS crisis, and Canadians have demonstrated an ability and a respect for health professionals and an ability to follow their recommendations that have kept us safe in the past and will keep us safe now going into the future. So while we are prepared for a wide range of scenarios, we will focus right now on what needs to be done now. And endeavor to make sure that that is enough, that we don't have to take future steps.
Bonjour. Il y a bien des Canadiens qui se demandent à quel point c'est sérieux ce qui guette le Canada. Vous qualifieriez ça comment? Comment qualifier ce qui guette le Canada potentiellement?
Je pense que c'est une situation sérieuse. Je pense que les Canadiens devraient être conscients de ce qu'ils peuvent faire pour aider à protéger leur famille et la santé de leurs voisins. Nous avons tous un rôle à jouer. Je pense qu'il y a matière à être préoccupé par ce qui se passe dans le monde. Quand on regarde ce qui se passe en Italie et en Chine et en Iran et ailleurs, il y a certainement des préoccupations sur l'impact sur la santé de leurs citoyens, mais aussi sur leurs emplois et sur l'économie. Nous avons la chance au Canada de pouvoir aider à protéger nos propres familles et nos concitoyens en changeant nos comportements de façon délibérée et réfléchie pour se garder en santé. Et c'est exactement ce que nous recommandons aux Canadiens de faire, d'être conscients que oui, il y a des risques, mais des risques qu'ils peuvent minimiser. Souvent, on a des crises mondiales ou des événements qui se passent où un citoyen moyen ne se sent pas particulièrement puissant pour pouvoir affecter le sort de leur économie. Et on est dans une situation où les choix que feront nos citoyens vont avoir un impact direct sur la santé du Canada et sur l'économie du Canada. Alors nous encourageons les gens d'en prendre conscience, de faire les choix qu'ils peuvent faire et d'écouter les experts en santé pendant que nous, on travaille pour s'assurer que, et au niveau économique et au niveau de notre système de santé, on a les ressources pour appuyer les gens qui font face à des difficultés.
Est-ce que des scénarios de mise en quarantaine de villes ou de régions ont été élaborés au Canada, advenant que la situation devait le commander?
On a préparé pour un grand nombre de différents scénarios. C'est la chose responsable à faire pour être prêt pour toute éventualité. Mais je suis très content qu'on n'ait pas rendu à ce point. Loin de là, on est au point où le travail que font nos experts en santé publique, que font nos niveaux de gouvernement, nos paliers de gouvernement, est en train d'être assez pour garder les Canadiens en sécurité, surtout si les Canadiens eux-mêmes prennent des mesures assez simples de rester chez eux s'ils se sentent malades, de tousser dans leur coude, de se laver les mains avec du savon régulièrement, d'éviter les poignées de main. C'est des choses que nous pouvons faire qui vont avoir un impact sur la sécurité et la santé de tous les Canadiens.
En théorie, c'est tout le temps qu'on a, à moins que vous ayez du temps pour une autre question.
Merci beaucoup tout le monde et à la prochaine.
If you found this video helpful, hit that subscribe button, hit that like button, share this video, and keep up to date on what's going on